Thank you so much, Anne. Thank you for inviting us to be part of this and co-hosting this wonderful symposium. Um, I'll get started by introducing our first speaker, Dr. Angela Jiang. She's an assistant professor here at OHSU and is specially trained in both dermatology and dermatopathology. This means that she has special expertise in the diagnosis of skin cancer, and her diagnosis and recommendations often guide the surgical management plan. Today, she'll be giving us an introduction to non-melanoma skin cancers. Thank you, Dr. Jiang, for joining us today.
Thank you for having me and for inviting me and for putting on this amazing symposium. So I'm gonna start. And so today I'll be talking about an introduction to non-melanoma skin cancers. And so non-melanoma skin cancers are basically a broad category of skin cancers. And basically it's all the other skin cancers that are not melanoma. And the most common ones being basal cell skin cancer and squamous cell carcinoma. But this category can also include other rare skin cancers that we won't be going super in detail in today. Unlike melanoma, these skin cancers aren't under like official cancer registries. So a lot of the statistics are often estimated based off of insurance data. But even so, we do know that non-melanoma skin cancers are far more common than melanoma. And it's estimated that 1 in 5 Americans will develop a skin cancer in their lifetime. So I'll start off by talking a little bit more about a basal cell carcinoma, which is the most common type of skin cancer. And about 2.5 to 3 million Americans are diagnosed with basal cell carcinoma every year. And to put it into perspective, there are about 1 million new diagnoses of melanoma every year. Basal cells are fortunately very slow growing, so they can grow deeper in the skin, but it's very uncommon for them to enter the lymph nodes or into the blood vessels. But sometimes if they are allowed to grow, they can penetrate nerves and bones and cause damage or disfigurement. Basal cell skin cancers usually come up because of long-term sun exposure. And then there are some genetic syndromes that make people more likely to develop basal cell skin cancers. And basal cell carcinoma, it can have a wide variety of appearances like we see here. I picked a few representative photos. It can start off as a pearly, like papule is what we often call them, but it can be this kind of like pinkish patch, or it can sometimes look like a scar. And sometimes it can be kind of scary looking and almost look like it might be a melanoma with some of this kind of like bluish gray look to it. And so seeing a dermatologist and kind of having an evaluation can be really helpful in these situations. Basal cell skin cancers, they most commonly are found on the head, neck, and arms, which are the most sun-exposed areas. Squamous cell skin cancers, or SCCs, these are the second most common type of skin cancer. And while there are 2.5 to 3 million new diagnoses of basal cell every year, there are about 200 to 400,000 new diagnoses of squamous cell every year. And similar to basal cell skin cancers, squamous cell carcinomas often develop from long-term sun exposure. They can also occur in areas with chronic wounds, and then we also can see them more often in patients who are immunosuppressed or have had an organ transplant. And squamous cell skin cancers have more of a potential to metastasize to lymph nodes, but it doesn't happen that often. It's about 1 to 5% of all squamous cells. And then they do have the potential to invade the nerves if they're allowed to grow too large. And these are some representative photos of squamous cell carcinomas. So it can look like a red firm bump, but it can also look like a scaly patch, or it can look like a sore that heals and then reopens. These also often happen on sun-exposed areas, and this photo is just to remind everyone to not forget to put sunscreen on your ears too. And then squamous cell carcinoma in situ is a subtype of squamous cell carcinoma, where the bad skin cells that kind of went awry, those are limited to the top layer of skin. And so when you go and get your skin checked by a dermatologist or another provider, not only do we look at all of your moles and compare them and look to make sure that nothing looks suspicious for a melanoma, we're also doing a skin check to make sure that there isn't anything that looks like a non-melanoma skin cancer. So when we do see something that looks suspicious, we rely on our clinical experience just from diagnosing a lot of skin cancers. But you may have also seen these handheld tools called dermatoscopes during skin checks. And basically, a dermatoscope is a magnifying, like it has a magnifier in it, and then it also has a light that can polarize on the skin surface. So we can see certain features a little bit clearer than others. And a lot of dermatology providers will train with these so then we can recognize the patterns of both melanoma and non-melanoma skin cancers. And so, for example, with a dermatoscope, when we look at a pearly pink papule, we might see these really crisp blood vessels that look like tree trunks. And then we become even more suspicious that something might be a basal cell skin cancer. But the only way to know for sure if something is a skin cancer or not is to perform a biopsy. So a biopsy is when we numb the skin with a local anesthetic injection, and then we'll use a blade to kind of remove the bump or the area that we're worried about so that we can look further under the microscope and know what's going on. And so when we perform a biopsy, the tissue that we remove goes into a formalin jar. And then that jar gets transported to a lab. And at the lab, they remove the piece of skin in the jar and they embed it into a block of wax called a paraffin block. And then our histotechnologists will then cut very, very thin slices from the paraffin block and put them on a glass slide. And so that's what pathologists can look at. And so pathologists are doctors who can diagnose things under the microscope and also can do a variety of other tasks. And dermatopathologists like myself I am a dermatologist, but I also did an additional year of training, just reading these glass slides and learning how to diagnose different types of skin diseases under the microscope. But pathologists also can do another year of training and learn to do the same. And so in dermatopathology, it's either dermatologists or pathologists, but we can diagnose other skin conditions under the microscope. And so when I look at one of these glass slides under the microscope, I might see something that looks like this. So if we look at, this is basically what, when we remove the skin, this is the top layer of skin. And then under the skin, we see these like very large purple bumps, and these should not be here. And this is what makes up a basal cell skin cancer. And then in contrast, this is something I might see that would be a squamous cell skin cancer. And these are slides that I've received kind of recently. But this has kind of like a pink glassy look to it and makes us more suspicious of a squamous cell skin cancer. And so when I diagnose these, then I release a report, which is something that both the doctors and patients can receive through their medical record. And it will have a diagnosis like basal cell carcinoma. I might describe the type and then tell you, and this is mainly information for the doctor or the dermatologist that you saw about whether or not the tumor goes to the areas that they sample. So I tried to go over kind of like the basics of skin cancers and talked about basal cell and squamous cell skin cancer, and then also how we make the diagnosis clinically, but more so under the microscope. But thank you for having me.